There's really no specific way to reduce a man's risk of getting prostate cancer. There is certain things a man can do to help with getting cancer in general, like being healthy, exercising, not smoking, not taking significant alcohol, and also paying attention to weight and obesity. Well, in general, prostate cancer is treated for a man with localized prostate cancer, meaning only in the prostate, with either surgery or radiation. And the surgery is where they remove the entire prostate. The radiation is radiation to the prostate and probably the pelvis. Then there's also the options for treatment for a man who has metastatic disease. And metastatic disease means that the disease has already moved into the rest of the body. Now, the first thing we do whenever we treat a man is use that strategy called androgen deprivation. And that is where we lower the testosterone level. And that causes significant benefit. And about 90 to 95% of men should go into remission with the androgen deprivation, the reduction in the testosterone. And then over the clinical course of a man who has metastatic disease, we would add other medicines selectively over time to continue to treat the cancer as the time course unfolds. Prostate cancer screening has been utilized for many years, and currently most of the large institutions that recommend screening, including the U.S. Preventive Services Task Force, the American Cancer Society, and American Urological Association, all recommend utilizing prostate cancer screening with PSA testing. This is a blood test that's done in your doctor's office, and from that we can hopefully detect cancer early. Now, all men should be screened for prostate cancer, especially when they're around the age of 50. There are some groups who are at higher risk, those with family history of prostate cancer or even family histories of other cancers should be considered screening at 45. Also, African American men are at higher risk for prostate cancer and should be screened around age 45. It's actually very important because African American men can be diagnosed with prostate cancer at an earlier age on average than their Caucasian or Asian counterparts, and they can be diagnosed with more advanced and more aggressive disease. So it's very important that a man sees his doctor, either his primary care doctor or his urologist. I'm Dr. Crain Garrot with Georgia Cancer Specialists, part of the Northside Cancer Institute. Again, I'd like to advocate that men who are due to be screened see your urologist or family physician to have PSA screening, and thanks again for watching.